I'm going to get started just because I have a lot to cover and I want y'all to hear it all, see it all. If you're coming in late, you'll get the replay. So everyone will get the replay anyway. So if something goes quickly and you want to go back over it, you're going to get the replay this afternoon to your inbox. We are going to cover everything I want to tell you about evaluations for autism, ADHD, and twice-exceptionality, that being kids that are gifted and also have a learning disability, autism, or ADHD. But we're going to go into all of that and what that is. So I'm going to talk for about 40-ish minutes. You're all muted right now, but when we get to the Q&A, you can unmute, but you can also put something in the chat if you want to be anonymous. I won't read any chat names, and unless I know you, and I know that you're okay with that. You can do whatever you want with your cameras, but if you want to put an anonymous question in the chat, I will try to get to it during the Q&A. If you're watching this on the replay, the Q&A is not there. I cut that out so that we have a more private conversation on these live calls. And all of these replays, you'll get to your email, but the catalog, the whole backlog of workshops is on Substack in the archive. And there's about 1.5 years of them. There's one every month, roughly. So if you're new here, welcome. I'm Emily. I am a child psychologist, former school psych. As I said at the beginning, I was a school psych in Texas before returning home to North Carolina. I've been in private practice in North Carolina simply because school psychologists in North Carolina only do testing. And at that point, I was highly trained in testing, but had wanted to do more consultation and therapy with kids. So that's how I landed in private practice. But I do love testing. I don't love report writing, but I do love testing. I love figuring it out and helping kids and families and teachers understand what is going on. And I also very much understand the limitations to testing. So we'll go through that today. I've been doing this work for about 20 years. So at this point, I've probably worked with hundreds of kids and teens. I'm also the parent to 2 neurodivergent boys. And I'm really excited that I'm writing my first book that will be out next year, which is all about how our kids learn. The first book, because I hope there'll be a second book, is going to be geared towards parents of elementary into like 6th grade-ish. And then, tween, teen, kind of that middle school, high school range is its own beast. So I'm hoping that there'll be a second book for that, but more to come from there. Okay. So how I define neurodiversity and neurodivergence is this, because this is an important foundation for moving forward. So we're all obviously neurodiverse biologically as a population, and then some of us are neurodivergent. And these are the diagnostic categories that most people view neurodivergence. We put autism under that umbrella, ADHD, twice-exceptionality, which is giftedness and some sort of disability by definition, like a learning disability or ADHD or autism. But the bottom line for me with neurodivergence is asynchronous development. So we've got strong skills in one area, needs for support in another area. This is what creates the anxiety, the struggle, the misalignment with this linear curriculum and linear expectations we have for our kids because they're this age, we think they should do this. And not necessarily, right? So, we will be thinking critically about that, where your kids are, and they can be at totally different places on different skills. Okay, if I pause every now and then, it's because I'm still letting people in. So a quick word about diagnostic labels, because I know we all have lots of opinions about this. So as we know, no 2 kids with the same diagnostic label are the same. They're all incredibly different. However, in my work, and you're going to get a different answer based on people's trainings, but in my work, we do need diagnostic classifications to access services in schools and in, through insurance and in private practice. We need diagnostic labels for access, and we need diagnostic labels for understanding. Those are really the two reasons we would do evaluations. The understanding could be helping educators have a new lens to see your kid. It could be helping you have a new lens to see your kid. It could be helping your kid have a new lens to see themselves. So if those are the reasons, we want to do it. And we're going to talk through more as we get there about those reasons. Overall, with evaluations, these are all the things we can look at. We can evaluate cognitive or intellectual, same thing, so IQ, ability. We can look at attention and memory, motor skills, academic skills, social skills, activity level, which is more of what an OT is going to look at, an occupational therapist, emotional regulation, sensory integration, and then communication. So the same provider doesn't test for all of this, but these are usually the areas that our neurodivergent kids have strengths and needs for support in, and finding out the strengths are just as important as finding out the needs for support, because when we know the strengths, that's how we know how to motivate our kids and communicate with our kids in that way and help them feel confident and as like a buffer to the times that things are harder for them. So I want to give like a bird's eye view of how I think about why we do this. Why do we need to do an evaluation? What are our goals over time for our kids? And there's a lot on this slide, so feel free to come back to it later. But everything that I've bolded is like an add-on to as our kids develop. So when they're really young, we just are thinking about their physical needs, their safety, their attachment, their emerging socialization, their communication, and all of that is in connection. And then as kids get older, we add in emotional regulation and attention to things. Then at school age, we add in the academics and the motivation and the interests. And then in the tween and teen years, it's the problem solving and the independence. You'll see the adult goals get shorter, in my opinion, because so many of these skills we work on, like social, communication, emotional, all of that just goes into relationships, right? That creates what our relationships are when we are adults. And then this all just leads, in my mind, to just satisfaction. It could be, we could call that happiness. We could call that I feel like I'm contributing to things, but some kids contribute to the world in their happiness and their joy. Sometimes they contribute in an interest or a job. So that word satisfaction is completely relative to everyone and different for every single kid and family and adult. So I'm going to take you through those different categories to think about testing. So at birth to 2, we are really thinking about just developmental milestones, body sensory development. We can start to see some emotional regulation differences, usually related to eating and sleeping and being able to soothe a child. We do start to notice speech and communication differences if even before words. So kids and babies and toddlers will communicate nonverbally before they learn to speak words. And we know this across all cultures that, we are nonverbal communicators with our body language and our eye gaze and our gestures before we have spoken language. And spoken language is just one type of language. We can communicate in many ways. And then that all goes into social development. So at this age range, in many states, it's different, but there's, under federal law, children have access to early intervention. And then every state uses different words to whatever the departments they call this. But usually the first individuals you'll see are your pediatrician, maybe a developmental therapist. That term is used in North Carolina. It may be something different, like an early interventionist that may come out to your home and help you with different things to learn to help your child, support your child. A speech language pathologist, occupational therapist, physical therapist. These are all people who work with littles, little tiny ones. And sometimes it's because kids are born prematurely, and we know from the get-go they're going to need some early intervention support. And sometimes it's because you're starting to see differences in their milestones, and that could be the first indication that you get an evaluation from one of these people. You'll see that usually psychologists and psychiatrists, that they're not involved at this age range unless there's something incredibly complex and specific going on. One of the first people who may do an evaluation with your child is a speech language pathologist, and they're looking at differences in speech and language. So speech being the articulation of the actual words, and language being the communication, which can be nonverbal or spoken. And so the articulation or the speech could be the sounds they produce, or it could be fluency. So the smoothness, and the speed with which they speak. And so this is where stuttering would fall. And those are things that cause a lot of frustration for young kids. So we definitely want an evaluation to look at that. Sometimes speech and language evaluations are the first to notice a difference that ends up being possibly autism or ADHD diagnosis. And that usually falls in the lines of looking at pragmatic or social language, because language really serves as a foundation for later comprehension, social comprehension, and literacy, and those things. And we'll talk about that when we get to reading disabilities. So going into the 3 to 5 year range, this is the most common time to notice an autism diagnosis or characteristics. And sometimes we'll notice ADHD if it's really intense at this age range. But from 3 to 5, play skills and social skills are emerging. Lots of emotional regulation and dysregulation at this age. Speech and communication is becoming much more complex. Kids have more motor skills, so they're able to navigate things independently and need to. This is where kids like move around and they get that sensory integration that they need. And we're starting to do a little academic in attention span. You'll start to notice that. So this is the earliest time usually that school or child psychologists will get involved. And you may go beyond your pediatrician to a developmental pediatrician if something more complex is happening. When I was doing evaluations with preschoolers, we can start evaluations. The earliest test starts at 2.5. Is it, super stable with the fact that, these kids are answering exactly what they know? There's some fluidity to that. I mean, I've administered these tests on the floor, sitting on the floor, because kids maybe are not sitting at a table yet. So when we're evaluating kids 3 to 5, many of these are play-based evaluations. Sometimes they're standardized, but we're just trying to get baseline and information that will help educators and parents know really the best classroom placement for them, and also the best level of support if they need any intervention. So often sensory needs are identified at this age range. So we, of course, have our 5 senses plus proprioceptive, vestibular, and interoceptive. So our sense in space, our balance, and then interoceptive is our internal body signals. So if you have a kid who is having trouble with toileting, or having trouble with pain threshold intolerance or heat intolerance, things that are feeling hungry and full, that is interoception. And Kelly Mailer's work is fantastic to learn more about that, if that's ringing a bell for you. So these are things that an OT is going to look at. So if you have concerns about any of the sensory needs, or if you're getting resistance to things, that's when you want to, think about sensory. Think about if your child is anxious. This is closely related to sensory processing. And some kids are sensory seekers, where many of them are high activity impulsive kids that usually do get an ADHD diagnosis. They're running and crashing and seeking out sensory input. And then sensory avoiders. So, and then yes, Liz, some are both, and that is tricky because they they seek it out and then they get overwhelmed. But it can be both. And that's why it's helpful to see an occupational therapist. They can help you figure that out. So for autism, you may be feeling like it's all over the map right now, I know, and this is one of the reasons I wanted to share, just information from the front lines of my training and from my colleagues' training. We can diagnose autism as early as really 12 to 18 months if it's level 3 autism. So we have level 1, level 2, and level 3, because it is a whole spectrum. Level 1 is going to be what we would consider mild, or what used to be called Asperger's. It is all under the umbrella of autism now. Level 2 is more moderate, and then level 3 would be more of a severely impacting functioning. But then on top of that 1, 2, 3 spectrum, IQ and language are independent of autism. So you can have autism with or without intellectual disability, and autism with or without um, language disability. So these are things that are complex. It is not straightforward at all. And that's why sometimes it's helpful to see a team of people who, like a psychologist, a speech language pathologist, and an occupational therapist. Sometimes you have to go to a university clinic for that, but many times the school-based teams will have those people. So, and then for level 1 autism, many of those kids, people, adults were not diagnosed in the 80s and 90s because we didn't define it that way. And so some of them are getting diagnosed later. Um, we do have lots of research surrounding that there's a high genetic component to autism, somewhere between 60 and 90%. Some people will say 80%. There is an unknown likely environmental factor, whether it's something in the mother's environment when she is pregnant, or if it's something else, we don't know yet. So there's still research ongoing to figure that out. Um, so this, of course, is characterized by delays in language development, social communication, and repetitive behaviors, interests, or rituals. So those are the things that individuals are looking for, clinicians are looking for. Developmental pediatricians can diagnose autism, so can school psychologists or child psychologists, and so can child psychiatrists, but they need to be specialized. And so I put their degrees after their names just to point out that medical doctors, MDs, and then psychologists, and there's 2 different degrees for psychologists. You can have a PhD, which is what we're mostly familiar with, or in the last like 20 years, a PsyD or a doctorate of psychology has become a thing, and that's totally a legit thing. I have a PhD just because my program didn't offer PsyDs 20 years ago, 25 years ago. When we are trained, medical doctors are trained to identify a problem and to give you a fix for it. And this, of course, is out of alignment with the developmental model, right? Of we're identifying a difference and we're structuring environment and interventions to support that difference. That's more of the developmental model. So psychologists are more trained on the developmental model of we're going to identify something and then we're going to give recommendations for support. And so you will probably get a more thorough, detailed recommendations from a psychologist or either in private practice or school psychology. Whereas sometimes developmental pediatricians are very thorough, but medical doctors tend to have shorter visits. They tend to, they are able to, some of them accurately are able to diagnose, but I do think some of the level 1s can be missed if the evaluation is not thorough enough. And that is just my 2 cents in my experience. One caveat to the school psychologist is that they are testing your child to document access to support at school. And then if you get an evaluation outside of school, that is going to follow more of the medical model diagnosis, but then the school can accept that and then say, okay, it fits in here with how we categorize things at school. When we get to Q&A, I'm happy to answer more about that. It's just different systems that have created different ways to label things, but it's kind of all talking about the same thing. Once we get into school age, cognitive or intelligence tests are getting a little more stable because kids are able to sit at the table and do our testing, right? Yes, Jada, thank you for saying girls are harder. And quick caveat, girls are harder because most of the research we have from the 80s and 90s and early 2000s is on white boys. And this is just kind of how things go in science, but also over time, we are just starting now in the last 10 years to study girls and to study a bigger range of racial backgrounds and different cultures. And so girls sometimes will have, like, let's say an example would be like a repetitive interest in pretend play. Well, it's the quality of it is really great, so they might get missed, but they only do that one thing over and over and over, right? And so then the repetitiveness though is there, even though the quality is pretend, which lots of boys struggle with pretend play. And that's one of their characteristics of autism. So these are all generalities. Every single kid is different, but thank you for pointing that out. Yes. So it's the kids that sometimes get missed when they're young are level 1 kids, and sometimes if they're not white boys and not showing up exactly how the criteria have been studied the most, I think we're really young in this field of really truly understanding all of how autism presents. So as we get into school age, we start getting into, is there a learning issue going on as well? So cognitive and intelligence tests get a little more stable. So if you have a child who was evaluated as a preschooler, children are best practices is to evaluate them every 3 years. So, many kids are evaluated at 3 and 4, and then they'll have another evaluation when they're 7 or 8. And so usually by the time they're 7 or 8, we're getting a little more clarity on, is this ADHD? Is this autism? How does this relate to anxiety and executive functioning? Is there also ADHD going on, or is that related to the autism? So it can be complicated. And so often we're looking for all of these things, and there is likely a child psychologist or a school psychologist on your team. And then for certain complex cases, especially with working memory, executive functioning, a neuropsychologist might be helpful. We think of neuropsychologists definitely if there's been any type of brain injury or any type of regression in learning. We want to figure out what's going on with that. But also, school and child psychologists do a great job looking at memory as well. But if you want to dig deeper, you don't have to have a neuropsychologist, but I would talk to whoever the psychologist is in your life. Even your pediatrician may be able to recommend that. And then you may have during these, age ranges, specialists that you might be seeing. If there are any, co-occurring things like OCD, obsessive compulsive, or tendencies, or if there's Tourette's or epilepsy, you're going to have a neurologist on your team. So there's specialists that might come in here. And then, of course, you might have psychiatrists who are specialists. Often your pediatrician is the one who will start out on suggesting medication, and then if it gets complicated, many pediatricians will want you to see a child psychiatrist. So usually in this elementary age range is where we'll see the most common time for a kid to be diagnosed with ADHD. We absolutely can diagnose 4 and 5-year-olds with ADHD. Usually it's the more severe presentation. There are 3 types of ADHD: hyperactive, impulsive, inattentive, and combined. And then pediatricians, psychiatrists, and psychologists can all diagnose ADHD. School psychologists usually collect the information, but then will rely on an outside provider, or a school psychologist will categorize this under other health impairment for medical diagnoses of ADHD. So pediatricians, psychiatrists, and psychologists all have very different training. So pediatricians and psychiatrists have similar training because they're both medical doctors. They go to med school, and then they do, internships, postdocs, fellowships, things like that to specialize. Their visits can often be much shorter, and they can talk to you, meet with your child, and diagnose ADHD on the spot. They could do that. That's not how I was trained, but they do that. I love to see pediatricians and psychiatrists use a rating scale and at least get information from the teacher and from the parent, definitely from the parent, just so they can see what the frequency is. How often is your kid struggling with these things? A psychologist is probably going to do intelligence testing and all the rating scales, and talk to the teacher and get more information across settings. That's just how we're trained. We're trained in more the developmental learning model of okay, this looks like ADHD, but how is it affecting everyone? Every state is different because every state has a different psychology board, but they're master's level psychologists and doctorate level psychologists. And both can do testing in North Carolina. So you would just talk to.
Definitely stressed.
Say that again. I think I'm getting an echo now. Anyway, So both can do testing in North Carolina, and so you would just talk to your you could talk to your school psychologist, you could talk to your pediatrician about what that looks like in your state. So there will be differences in those appointments, definitely. And okay, thanks, Liz. Y'all just double check that all of your mics are off. That would be great, that you're all muted. So one quick caveat here, even though I know we're talking about evaluation, is that many people will get an ADHD diagnosis for their child and not be sure what to do with it, right? You know, they kind of know already, my child's really active, my child's impulsive, I have ADHD, it can, you know, it's highly genetic, you know, it's not a surprise to many families. Where I like to start with young families or young kids is making sure that they're getting enough movement, they're getting enough sleep, their nutrition is on track, and that the role of the environment makes sense. So think about when your kid is in a classroom, expected to sit in a chair with 4 walls around them. What does that look like compared to when your kid doesn't have 4 walls around them, like swimming in the summer or being in wide open spaces, and how that changes it in their in their environment, right? And so many parents I work with, especially white dads, again, no offense to white dads, but you were the ones that we had the research on in the 90s and not on other people like women and all different racial backgrounds. So we are having more women now where we're learning more, like women in their 40s getting diagnosed, because we're learning more about it. But just to think through movement, sleep, nutrition, and the environment in addition to medication. You know, history of, you know, the medical model, of course, is you have ADHD, here's some medication, right? That's not my training. That is, medication is one tool in the toolkit. And sometimes incredibly helpful, but also we have to be, you know, step back and we have to see it within the context of everything else. In elementary, when we're doing intelligence testing, we can start to look at giftedness. Now, in North Carolina, kids are not tested in a big group for giftedness or the gifted program until 3rd grade, but we absolutely can usually tell earlier. Teachers have a hunch. If you ever talk to giftedness teachers, they're like, yes, I absolutely knew this kid was gifted before we got to that point. So starting school early because the giftedness can be tricky, because school readiness is not truly about 100% about learning. It's also about emotional regulation and independence. So those are things to talk to preschool teachers and your kindergarten teachers who know your kid to see what their opinions are about that. So what's hard about giftedness and twice exceptionality is this asynchronicity between the linear curriculum and their brain, who may be gifted up here and have a need for support down here. And some kids are early readers, and we have to, you know, that's kind of an easy one to accommodate because we just give them more advanced books, but we need to be coordinating that with the teachers around them. But that's sometimes the first sign of, I need to evaluate for giftedness. This kid is a high reader. And a lot of people, my caveat here with giftedness testing is a lot of people say, well, why do we need to identify that? It's not a clinical diagnosis, right? But if we don't support and kids who like are sitting there having already learned what's being taught to them, we start to get social and emotional frustration. I worked in graduate school. I studied the social emotional development of twice exceptional kids 25 years ago. And we have lots of research to show that these kids start to give up on learning because they're bored, they're not engaged, and this is the untapped potential we want to be tapping. And of course, there are kids with both, which we'll talk about after we go through the different learning disabilities, and those twice exceptional kids are at even more risk of struggling socially and emotionally, and that's why we need to do these evaluations. So really quickly, you're probably pretty familiar with reading, writing, and math disabilities, but these all have similar words. Dyslexia is same thing as reading disability. Hyperlexia is something that often young autistic children will do. They'll teach themselves to read. They don't learn with phonics. They just can read everything. They may or may not be understanding what they're reading, which is the comprehension. So decoding is sounding it out. Fluency is how quickly you read, and then comprehension is understanding. So if there's a weakness in any of those, that would qualify for a reading disability. If it is different, statistically significantly different from what we would expect from their intelligence. So we want to start making connections between their social skills and reading comprehension, because sometimes, especially with autistic learners, these are very similar skills. Because if you think about it, predicting what happens next in a story or predicting why a character did something is a very similar skill to predicting why that kid on the playground got in my space and did that thing. So there can be a connection between that abstract thinking and reading and the abstract of the pragmatic skills in play. And only psychologists, either master's level or doctorate level, can evaluate for learning disabilities. There's some states and some clinicians where I know in Texas you have educational diagnosticians where they do the testing, and so some states have a different role for that, but in most states only psychologists will do that. Dysgraphia or writing disability, that's also the same thing if you hear those words. Many times a reading disability and a writing disability will go hand in hand. And a psychologist is looking for the fine motor skills, how quickly they're writing or how slowly they're writing. Can they pay attention to writing? Writing is, I think, the hardest academic task because you have to use executive functioning and literacy and fine motor skills. It's using all of these things, and the topic you're writing about, it is the hardest for many kids, and there are lots of ways we can scaffold support for that. And the purpose of an evaluation here is to figure out, okay, where are the weaknesses and where can we support this kid's writing process to reduce the anxiety. And then math disability or dyscalculia, you'll also see as a term. We're looking at, we learn early on, kids learn with one-to-one correspondence through play, but then that translates into elementary school more as learning. There's rote memory of math facts, and then there's fluency, how quickly can you do these things, and then there's anxiety that often comes when we shift. I always see it in about fourth grade when we shift to fractions and division. There's this conceptual math knowledge that's a jump that is hard for lots of literal thinkers. So lots of kids with an autism diagnosis may also have, they may like math early on and then struggle with the conceptual math. Although there are also kids that are exceptional, autistic kids that are exceptional at math. So every kid is different, but these are some of the things that we are looking for when we're teasing all those things out in an evaluation. And then a twice exceptional kid could have all these things happening. So you can imagine how important it is to figure that out. Again, if you think your child might have a high intelligence and that by itself, right, it doesn't feel like, I don't know if I really need to figure that out, but they could also have something that feels kind of average to them that could relatively feel like they're behind, even though it's average compared to other kids. And that's helpful to figure out in an evaluation. So following your child's confidence is like a magic wand. Where are they confident? That means they're good at that. And making sure that we're noticing their emotions around those asynchronous skills. I'm just going to give you all a little time check because it's not going to be about 40-ish minutes. We're going to go a little longer, but I will stay over for the Q&A just so that you know. Okay. I know that this path feels anxiety provoking at times because it's unknown, but it also is full of hope and surprises. And we have to just let go of whatever that plan was we thought school would look like, or we thought our kids' learning would look like, because that's not the path we're on. We're on their path. And I feel like over time, it's a privilege just to figure out and help them on their way. But this is one of the hardest parts of the process. And I knew everything about this process, and it was still an incredibly emotional process when I went through it with my kids. So when to consider an evaluation. If your kid is frequently distressed about learning, about emotions, about behavior, something is too hard, something's going on we need to figure out. If their behavior is inconsistent, either their skills, learning, or behavior is inconsistent across school and home, you might be able to figure this out by troubleshooting things with the teacher, and it might be at the level where you need standardized tests with a psychologist to dig into this. If you feel like your kid is being misunderstood by others and they are being treated as like they're not making the right choice and you feel like it's a skill weakness, we need to look at this more to be able to define the skill weaknesses. Or if you suspect your child might need some sort of treatment or intervention, that's definitely why we do these evaluations. I'm going to throw anxiety in here because this is the other one that you're never going to question if you need an evaluation. If your kid won't go to school, you can't miss it, right? If they're hiding, if they're running, if they're aggressive, if they're lying, arguing, these are all things like we got to figure out what's going on. However, there are also some types of anxiety that are, we might miss, right? And so it's helpful to think through what could be figured out if in an evaluation. If there's some sensory overwhelm, if there is some anxiety, whether it's performance, perfectionism, people pleasing. Sometimes kids are like really great students, but you feel like they're wound up tight. If there's anxiety in there anywhere, we probably need to figure out where it's coming from. And that's why sometimes a pediatrician will refer a family to someone like me, because it's not just, I mean, it is anxiety, but it's not just anxiety in the sense that it's anxiety in reaction to something that is not being supported enough, and an evaluation would figure that out. So, and if you've decided you want to go through with an evaluation, you can start by talking to your child about normalizing that we all learn in different ways and validating their experiences, sharing your experiences, even if it's like, we didn't look into this when I was younger and I wish we had. And explaining that there are people like me and people at school who can figure out how they learn best, and that will just model advocacy for them. Like good news, we can figure out how you learn best. And then you'll have to decide who to see. And thinking back to what we talked about before of, is it going to be just a psychological, which would be just intelligence and maybe figuring out ADHD and anxiety? A psychoeducational is going to include reading, writing, and math. That's the only difference there. And then a neuropsych eval, like I said, is going to go more in depth with executive functioning, and figuring out anything neurological, that any differences that you've seen. And so psychoeducational evaluations, again, can be done at school, or they can be done in a private practice. They can also be done in a hospital clinic, but you may not need that. Hospital clinics, like, so local to me are UNC and Duke. They have very long wait lists because most of the time people like travel from all over the state to come there. They're usually targeting, presentations of kids that are really complex, that have multiple diagnoses going on, or that you need a specialist for. So those are just some things to think about. However, the caveat to hospital clinics is they usually take all the insurance because they're affiliated with the hospital. So that's another reason they have really long wait lists. And then figuring out which evaluations are necessary. And this is tricky and individualized to your kid. So you will just have to talk with either the school psychologist, or if your pediatrician has a recommendation, for someone like me to meet with in your community. So you're going into this thinking the purpose of this evaluation is to just figure out your kid's strengths and needs for support, and to figure out if this learning profile that they have meets criteria for a diagnosis, or if it doesn't. And we also want to figure out how much anxiety do they have, and is it impacting their learning or their development. And then, of course, we want recommendations for support. And so sometimes if you see a medical doctor and you just get the diagnosis, you might be feeling like, well, what do I do now? So you might want a more thorough evaluation with a psychologist that will give you the recommendations for support. And then sometimes a psychologist won't test autism. They may just test the learning part. So they may refer you if they see characteristics of autism or ADHD, or they may see language weaknesses in addition to a reading disability, or motor needs that a sensory motor needs that an OT would need. So you may have a child that you end up having a psychoeducational with a psychologist, a OT doing an OT eval, and then a speech language pathologist doing a speech eval. We call it speech eval, but it's speech and language eval. It's not just the speech. And usually the process with a psychologist is going to be a meeting with you. And then there's behind the scenes stuff like history forms, teacher rating scales, parent rating scales. Sometimes doing an observation. School psychologists will definitely do a classroom observation. A private psychologist may or may not actually be in Wake County, where I am. We're not allowed to go into the schools. We're allowed if it's a private school or a preschool. So this is tricky but I talk to teachers a lot when I'm consulting with families. Usually what your child will be present for is 1 to 3 sessions, depending on how old they are and how long their attention span is, about 1 to 2 hours each, where they're doing activities and answering questions with the provider. And then there'll be a feedback session with parents and a report for you to review. That is sometimes very overwhelming. So I'm going to skip ahead to this, and you can come back and look at this, but all the scores in the report, you're going to see lots of different types of scores and lots of different numbers. I just encourage you to look at the ranges, average, below average, high average, above average, those types of things, to figure out the strengths and the support needs, and to pay attention to the memory skills and the anxiety that's noted, because those things are going to impact learning on top of any other core strengths or weaknesses that are found. Most of the testing is going to be on a bell curve. So when you see scores like 100, that's average, just as a little caveat there. And I want to share, I'm going to stop this screen and share another one. And I'm going to give you, I'm going to send you this link to, hold just a second. Okay. Hey, everyone. Let me get my mapping skills for you. I'm going to send you this link so that you will be able to print this out. And if you are reviewing an evaluation report, it can be so overwhelming. This is a worksheet I created for my online parenting course. I also have a teacher version of this that if you're an educator or a school psychologist, or you feel like you would want to share this with an educator, it's similar, but a little bit more school focused. So basically what you would do is, these are in sections of sensory development, motor development. An evaluation may not look at all of these, but what you can do is go through the report and take notes on, what are my kids' strengths in this area? What are their needs for support? And what are our goals? And it just goes through each area, and it's 4 pages total. So it takes sometimes like a 20-page report, and it can take you through to list these things out, and it helps you condense it, as well as this is a piece of paper you could give a teacher who, yes, they're supposed to read all of the evaluations, right? But they may not necessarily have time to do that. So it can be really helpful to do that. And I will send you that when we get to the end, when you get the replay. I'll include that as well. Zoom makes me re-click on everything before I can share it. Okay, here we go. So when you're looking through those results, you'll see lots of scores. And then the goal here is to find a strategy, to help your kid with thinking about what their relative strengths are. Sometimes when I say standardized strengths, I'm talking about the bell curve compared to other kids their age, relative strengths and weaknesses compared to the other skills they have. So a good example of this is the twice exceptional kid may have, a superior intelligence and then their reading skills may be solidly average, well, that's the same as other kids in their class, but it could feel like a weakness to them. And they could feel slower with reading than they are at math if their math is also superior. So we need to also look for relative strengths and weaknesses and help your kids' educators understand that too. I always look for strengths first because this is where our kids' motivation comes from, right? And then we look for lagging skills to figure out, okay, what skills do we need to support? Because often the strengths become the motivation, like the intrinsic motivation, the incentive inside our kids that they have to keep working and be more engaged. And we want to use those to bridge the supports that they need, to bridge that need for support. Okay, we did it. I talked a little more than 40-ish minutes. So we're going to go into Q&A next, but I wanted to share a few things. If you're new here, all of my blogs on Substack are free. All of my podcast episodes are free, and of course, social media as well. And again, I have two workshops that are free. One will be this one, and then one is about how to talk to your kid about their neurodivergent brain. I just want that information to be out there. And then if you want to join other workshops, in addition to the private chat and Substack, is what paid subscribers get with that. And then, oh yeah, so next month we will be talking about summer screens and siblings as we go into summer. That will also be on a Friday at 10. I think that's the first Friday in June. And you'll just get an email again, an RSVP. And then I am having a spring sale right now on the 2 on-demand courses. The one on the left is my parenting course. Anyone who's new to this journey or just wants a refresher, those are 6 30-minute videos, so easy to listen to on a quick walk or on a drive. I wanted to share my teacher training here just because of the time of year. Many parents like to gift this training to teachers that they know. So you can do that just by entering the teacher's email at checkout. And those are both at those links there. But if you just go to my website, you will be able to figure it out. So y'all start dropping questions in the chat because we are going to do Q&A next. Okay.